Madam President.
The Senator from Florida.
Madam President, I ask unanimous consent that the quorum call be vitiated.
Without objection.
Madam President, I'm here today to talk about the Zika virus, which we've been hearing a lot about in the news lately. It's a virus that has first begun to appear, and well, obviously been around for a long time, but we've begun to see it in the news lately with regards to its implications in Brazil and in Latin America. But it's now found itself here in the United States. And there's been a lot of discussion about it. As you know, the President has requested $1.9 billion to deal with this. There's a lot of different things we need to do to address it. And there's been a little bit of a squabble in the Congress about whether or not we should be spending that much money on it. So one of the things I argued for, and it's happened, is that we should take some of the money that was set aside for Ebola. When the Ebola crisis was going on, it was about $500 million of that had been unspent. And I argued that before we go to the $1.9 billion, there was $500 million immediately available. Let's assign that to be used, and the President has agreed to do that. But there's still a shortfall on this issue, and it does need to be addressed, and I hope that we can find a way to address it. And obviously my political differences with the policies of the White House are well known and established, but this is an issue where I hope we'll be supportive of this request. And to be abundantly clear, it's not just about throwing money at it. We have to make sure that the money is being spent on the right things. It's not just saying, here's $1.9 billion and throw the money at Zika. You want to make sure, number one, that it's all being spent dealing with the virus. Oftentimes in this place, when money is assigned for a catastrophe or a disaster or anything like this, and a breakout of a disease, suddenly you see all kinds of other ideas and programs attached to it that have nothing to do with the primary reason for why the money is being spent. And so we want to make sure, number one, that if there's $1.9 billion that's going to be spent on this, that all of it is spent on this and not on some other things. The second is we want to make sure the money's being spent on the right things. And what are the right things? Well, we've discussed those over the last few days. One of the most important things that needs to happen long term is the money necessary for the basic research to incentivize the vaccine. There's the belief that they can pretty quickly get to a vaccine that will protect people from this. So that's important. I think there needs to be thought put into the testing. Testing for the Zika virus today is less than reliable. There's not a commercially available test. For example, in Florida, if you want to be tested for Zika, it has to be through the State Department of Health. You can't just go down to Quest Laboratory or one of the providers of lab tests and get it. There's not a commercially available test, so that has to be improved as well. And so these are the sorts of things that I hope the money will be geared towards, and this is why it's so important. I don't want us to take our eye off of this, because if this issue really takes off on us here in the United States, we don't want to say that we knew it was happening, but we ignored it and we did nothing about it. So on Monday of this week, there was a Reuters report where the U.S. officials warned that the Zika virus is scarier than they initially thought. The Zika virus is now present in about 30 states. And by the way, there are hundreds of thousands of infections that could appear in the territory of Puerto Rico. Here's a quote from the Deputy Director of the U.S. Centers for Disease Control and Prevention. It says, quote, "Everything we look at with this virus seems to be a bit scarier than we initially thought. And so while we absolutely hope we don't see widespread local transmission in the continental United States, we need the states to be ready for that," end quote. As of now, from my understanding, there's only been one case of transmission in the continental United States. That happens to be in Polk County, Florida, but there are dozens in the territory of Puerto Rico, and so this is deeply concerning. The other thing that they found is that the mosquito species that primarily transmit the virus is present in about 30 states, rather than the 12 as previously thought. And so that too sent the fact that this could be a very serious issue that could find itself in places even outside of the tropical climates we once thought this was limited to. Then on Wednesday, the Centers for Disease Control, this is of last Wednesday, the CDC said that it is now clear that Zika definitely causes severe birth defects. Confirming the worst fears of many pregnant women in the United States and Latin America, U.S. health officials said Wednesday there is no longer any doubt that the Zika virus causes babies to be born with abnormally small heads and other severe brain defects. And this is something that now, looking at what's happened in Brazil and other parts of the country, there's now real concern about what this can mean for pregnant women and the ability to transmit that to their children or to their unborn child, and the effects of it are devastating. Now, initially it was thought that the Zika virus is very dangerous if you contract it in the first trimester, but after that the risk is no longer as grave. But on Thursday of this week, we get the news, this was reported in USA Today, that the Zika virus may in fact affect babies even in the later stages of pregnancy. The Zika virus may pose a threat to women and their fetuses even in the later stages of pregnancy, according to a study published online Wednesday in the BMG, which was formerly known as the British Medical Journal. Doctors had initially suspected that Zika infections, which are largely spread by mosquitoes, would be most harmful to fetuses in the first trimester of pregnancy, or the first 3 months of a 9-month pregnancy. In the study, however, 23% of the mothers of babies with microcephaly were infected with Zika in the second trimester. 2 mothers were infected in the 6th month of pregnancy. None were infected in the 3rd trimester. And the babies in the study had problems that went far beyond simply small heads. The brain damage seen in the study was, quote, extremely severe, indicating a poor prognosis, according to the study. So the authors of the report have now expanded the study, 130 babies with microcephaly. Several infants have had epileptic seizures within 3 to 5 months after birth. The extent of the brain damage seen in the babies in the study, which was captured in MRI images, was stunning, according to James Bale, Jr., a professor of pediatric neurology at the University of Utah School of Medicine. This is a quote, "This is a really remarkable degree of damage. Babies with this condition have severe microcephaly, extra scalp skin, intellectual disabilities, and prominent occipital bone, which is located at the back of the head, according to the CDC. By the way, these fetal brain disruptions that we've talked about is normally extremely rare. A 2001 review in a medical journal identified only 20 cases, according to the CDC. So this is something that we're looking at that doesn't normally happen as a normal risk, but it's clearly being exacerbated by the Zika virus. In fact, in MRI images published by the BMG study, one baby appears to have a very small, even non-existent brain. Judging by the damage on the MRI, the baby in that image is likely to have severe cognitive impairment and may be unable to learn to walk or talk. So that's why the same day I sent the letter to the Centers for Disease Control. And I sent a letter to them regarding Zika testing backlog. On April 8th, I had hosted a briefing in Miami a week from yesterday with representatives from state health departments, local health departments, and county government officials. And that included health officers from Puerto Rico. And I publicly, as I said at the time, offered my support for the President's emergency supplemental funding request. While I heard there were about many obstacles that we face in fighting Zika, one aspect I heard about repeatedly was the distressing length of time it takes for diagnostic tests to be completed. I have subsequently seen media reports of pregnant women who have waited up to a month for the CDC to complete their diagnostic tests for the Zika virus, while fearful mothers anxiously await to know their child's fate. Of course, we're still waiting for the supplemental request to be passed, and I hope we can do that quickly. There really is no reason to wait on this. But until Congress approves the request, I urge the Centers for Disease Control to use whatever steps are necessary to dedicate currently available resources to clearing its current backlog of Zika diagnostic tests and to prioritize these tests for women who are pregnant. I believe these essential steps will help us not only to ease mothers' minds who test negative for the virus, but also to provide critical care for a child whose mother tests positive for the Zika virus. We know that screening for microcephaly should happen early and often, and receiving the results of a diagnostic test is the first step in that process. The CDC should have the capability to provide those services immediately to those who are waiting. Ultimately, it's my hope that the U.S. Food and Drug Administration will approve a commercial Zika diagnostic test in the near future so that these tests are more broadly available. One more thing that I think was reported on Wednesday was that the House GOP is readying a Zika funding plan. House leaders are working on approving more funding by the end of this year. And I would once again encourage them to do so in light of the circumstances we now face. I'm not saying this is going to be an outbreak of crisis proportions, but I am saying for a family that is potentially impacted by this, this will be a crisis. I am saying it's important for these testing kits to be available, by the way, not just to expectant mothers or potentially pregnant, but also to men. Because as we know, the Zika virus can also be transmitted sexually, as it was in the infection that occurred in Polk County, Florida. And beyond it, I hope that in this funding request that we don't wait till the end of the year. The summer months are coming. And these are the months where the spread of these mosquitoes, the two strains or the two types of species of mosquitoes that carry the virus, are going to become prevalent in many parts of this country. It's the time of year when many people find themselves outdoors exposed to these mosquitoes. And so I hope that the funding request can be in place and that we don't wait till the end of this year to deal with this. It shouldn't take this long. Look, I believe in limited government, but I do believe one of the obligations of a limited federal government is to protect our people from dangers, whether they be foreign enemies or the risk of disease outbreak. And so I hope that we will move forward on this endeavor because it's important. It's a proper function of government. And we shouldn't be sitting here 6 months from now regretting that we didn't act sooner. And so I hope that we'll move promptly and quickly, both in the House and then in the Senate, to address this issue. And I would want to close by saying I don't want to forget about Puerto Rico. Oftentimes people forget that Puerto Rico is the United States. The people who live there are U.S. citizens. And there is already a severe outbreak when it comes to Puerto Rico. They are already facing this crisis. And so it's important. If this was one of the 50 states, they would have a senator here on the floor right now, maybe two, arguing on behalf of it. Obviously, Puerto Rico doesn't have a senator elected from the island. So I hope to stand here today on their behalf to argue that this is an important issue that needs to be addressed for the sake of our country, but most immediately for the sake of the territory of Puerto Rico. And so I hope that we will move quickly to confront this issue and to solve it. And I would close by saying one more thing. While government has an important role to play, ultimately we have a responsibility. If you are traveling to parts of this world where you might be exposed to the virus, I think you have an obligation to get tested to ensure that you're not going to be transmitting this to your partner. If I think as I argued last week at my press conference, if you're going to be outdoors, you have an obligation, I think, to use mosquito repellent to protect yourself and your family from being exposed to this, just the same way you would wear sunscreen. I think it's important for us this summer more than any other. And by the way, it's not just Zika that mosquitoes transmit. They transmit all kinds of other very serious illnesses. There's a level of personal responsibility here. We talked about people not allowing bodies of water, whether it's undrained pools or puddles of water in your backyard. These mosquitoes can grow in water containers as small as the cap of water, a bottle of water. They don't need a lot of water in order to reproduce and grow. So there are things we need to do in our own lives to take personal responsibility for dealing with the Zika virus. But there is a proper role for government, and I hope that we will play it. We have an obligation to hold the government responsible to ensure that the money that is appropriated is just being spent on Zika and is being spent appropriately on things that work. We should be working with our local and state partners to ensure that we are funding the programs that work and that need to be funded. But I think we need to get it done. And I hope that we can get it done here rather quickly because the summer is upon us. And I don't think we want to be halfway through the summer and wake up to the news that hundreds and hundreds of Americans in multiple states have been infected, and we did nothing. We'll have to explain that to our constituents. And I'm not sure we're going to have a good explanation if we don't act. With that, Madam President, I yield the floor and suggest the absence of a quorum.
Clerk will call the roll.